AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctors. I'm Lorena Anderson, your life and energy coach, and also your host for this evening. And I'd like to welcome you to our show that airs every Tuesday evening between the hours of 6 and 7. You can follow us on 1470 AM, and we're also streaming live on allcountyhealthcare.com and also wwnnradio.com, where you can follow us no matter where you're at, whether you're on web TV or if you're on the radio or in the car. This is an interactive show. So we would love if you would call in with any questions that you might have for our guest. The telephone number is 888-565-1470. So please give us a call. This is being presented by AMP2 TV and also proudly sponsored by All County Healthcare, where patients are the heart of their business. And that's really important because when you want to have somebody that's dependable and that cares, that has compassion and patience, it's really, really important to give All County Healthcare the call. And welcome to our Facebook friends, because we're streaming live on All County Healthcare. And if there is any question that you might have about All County Healthcare, please just give them a call, 888-717-7170. Ask for Maddie. She would love to answer any questions that you have concerning your healthcare needs. So without any further ado, I'd love to welcome our guests. Again, thank you, All County Healthcare, for bringing on these guests, because they are the individuals, the professionals, the experts in the industry that can help you make those choices that are so absolutely necessary for your healthcare. So I would like to introduce our first guest this evening. Hi, Dr. Charles Graubert. You
said it perfectly.
I did? Okay,
yes.
Okay. I've been practicing, can you tell? Welcome to the show. It is wonderful to have you here this evening. I know your schedule is incredibly busy, so I really do appreciate you taking this time and helping to inform and educate our audience. So please tell us your specialty.
My specialty is physical medicine and rehabilitation, also known as physiatry.
Physiatry. Well, that's the first one. I've not heard of that one before. That's very interesting. Tell us more about that.
Well, it's psychiatry, doesn't it?
Yeah, it does. Without the pills? Oh, no, maybe with pills.
I think every doctor has a little psychiatrist in him.
Yes.
But the specialty is really all about helping people get better who have injuries or diseases affecting their musculoskeletal or neurological systems. Mm-hmm. And so it can be anything from simple sprains and strains to more complex things like brain injuries and strokes and spinal cord injuries. And so the specialty encompasses all of that.
Wow. Well, that really must keep you busy. It sounds like you have, there's many, many different facets to your particular specialty.
It never gets boring.
Yeah, I would think so. So tell me, give us some of your background. Where did you go to school? Where did you grow up? And what made you decide to go into this particular expertise?
Well, I'm from South Florida, born and raised in Miami.
Oh my gosh, a native.
A native Floridian. Been through a few hurricanes myself.
Oh, yeah. Not that we're not looking at any hurricanes right at this very moment. Thank you, Matthew. Go ahead.
Went away to college and then came back to medical school at the University of Miami, and then did my residency training at Parkland Hospital, which is University of Texas Southwestern in Dallas.
Wow, okay.
So I was there for 3 years and then decided to come back 22 years ago, back to South Florida, and moved to Palm Beach County and joined a practice and have been with that practice ever since.
Have you? Oh, my goodness.
Yes.
So it says here on your card that, you've been in business for 65 years. I was looking at you and I said, no, you've got to be kidding me.
I started very young. Right.
Well, it sounds like this particular practice that you've been at. Well, first of all, where can they find you? I mean, where is it located? Your telephone number, email address, or your website?
Sure. So we have been in practice for 65 years as a practice. And of course, we've had several different groups of doctors that have come in over that time. So I started with the group 22 years ago, and now we have 14 physicians in the group, and we're a multi-specialty group. And I'm the sole physical medicine and rehab doctor in that group. And basically, I provide non-operative orthopedic care in the group.
Oh, okay.
So we have 3 locations. And I say that because our third location is we're going to be moving our third location very soon. So our main location is in Atlantis, right on the campus of JFK Medical Center.
Oh, okay.
And we have another location in Boynton Beach, and that location will change within the next month. We're soon to move to a new office in that area.
Oh, wonderful.
Right, so
good for you.
That's going to be off the Boynton Beach Boulevard, Eau Claire Ranch Road area.
Is that an expansion for you?
Well, we're in an office now, but we decided to build our own building.
Oh,
and
that's great.
Right, so we have our own building. We'll have our own surgery center in the building also because most of my partners perform orthopedic surgery. So that location will open November 1st. And then we have a third location that's going to be opening probably in February in the Wellington area off the 441 corridor near Wellington Regional Medical Center.
Oh, okay. Okay. Oh, that's wonderful. That's a beautiful area out there. Anyhow, well, congratulations.
Thank you.
Sounds wonderful. That's just great. And it sounds like, you know, your practice is really bringing a necessary element to those areas. And what are some of the specific difficulties that your clients, your patients might come in with?
So for me, I do a lot of spinal work.
Okay.
And so most of my patients come in with a complaint of pain. You know, they have neck pain, mid-back pain, lower back pain. And so what I do is take a history, do an examination, order whatever types of diagnostic studies I might need. Sometimes they need a battery of tests. Other times they come in with tests that have been done by other doctors. And then I come up with a diagnosis and then a treatment plan that is really tailored to their needs and helps them.
What do you see most of? What usually comes in? Is it a lower back? Is it mid back? Is there any one of those areas that you see more of?
I would say primarily low back pain. It's not the only thing that I treat.
Right.
You know, with our geriatric population, of course, I see more older patients than younger patients. And so a lot of them have degenerative diseases and problems, mostly related to the aging process. So you've got arthritic conditions that affect the spine. You also have conditions like diabetes and obesity that can really affect people's health. So I have an interest in that as well, and trying to help prevent injury and get people better by addressing those areas. But most of what I treat is low back pain, and that can be brought on by, you know, a multitude of injuries, causes. And so we try to properly diagnose the patient and then tailor make a treatment plan, you know, for them specifically. Excellent. So I know I asked this about to you before, but what made you decide to go into this? What ignited that passion within you to go into this specialty? Well, I knew I always wanted to be a doctor from a young age, and I really wasn't sure what I wanted to do. I always gravitated towards orthopedics, and I thought I might want to do surgery and you know, work with tools and construct and fix and do things of that nature. But then as I got into medical school and I started learning a little bit more about some other areas in medicine and the rehabilitation side of things, I thought that I could do a very similar type of medicine, but focus more on the rehabilitation aspects of that in a non-surgical way. So I hadn't been exposed a lot to my specialty because, you know, 25 years ago, there weren't a lot of doctors doing what I do, especially in the state of Florida. We didn't even have a training program in the state of Florida.
Really? Wow.
So I spoke to one of my med school classmates who was a few years ahead and had graduated and gone into this field. And he kind of steered me in that direction. And then, you know, that's the direction I decided to go. Got accepted into a residency program and here I am now 22 years later.
Wow. Wow. Well, it sounds as if, just the right doors had opened for you at the right time, because you're right. 25 years ago, they didn't have your specific specialty. They were still busy going in there and doing surgery and everything.
Well, it's interesting. The specialty actually was started in the mid 1940s. But a lot of people didn't know about the specialty because it was closely tied into physical therapy. So they thought a lot of the doctors were physical therapists.
Okay.
But they were actually medical doctors. And after the polio epidemic hit, there was a lot of patients that needed to be rehabbed in this country. And so the specialty became much more widely accepted. And then there were a lot of veterans coming back with injuries from World War II and the Korean War. And that sort of launched the specialty of physical medicine and rehabilitation.
Wow. Well, that's really interesting. Thank you for that. Well, you do something really that's quite different as well. And we're going to talk about that in a second. But at this moment, I just want to say thank you, All County Healthcare, for providing this show, You and Your Doctor, Living a Longer and Healthier Life. Thank you so very much for putting this show together so that we can, first of all, showcase some of the doctors that are available out there for you, but also to allow you to become educated and know where you might need to go in order to get the proper health care that you so necessarily need. So I want to thank you again for being on the show. But I want to go back because there was something very interesting that I learned about you, and that is that you do acupuncture. And you don't very seldom hear that a medical doctor, an MD, ends up doing acupuncture. Tell us a little bit about that.
Yeah, so 10 years into my career, I was becoming a little burnt out with treating people for pain and being frustrated that I didn't think I could help them the way I wanted to. Mm-hmm. And I had certain subsets of patients that would come in that maybe were searching for certain types of narcotic medications. And I felt sort of stuck and wanted to be really careful about how I practiced, keeping myself and the patient out of trouble. And one of my partners, just on a whim, suggested, why don't you look into acupuncture? And so I found that there was a course at the University of Miami, and that's where I went to medical school. Okay. So I looked into the course. There was only a few courses in the country that did
I was going to say, yeah, that's so unusual.
Right. So there was one at University of Miami, which was close enough. There was another one in California, and that required a lot of travel and taking me away from the practice. So I decided to go back to my alma mater, and I decided to do this class, a course. It was a full 6-month course, and it was done practically every Saturday for 9 hours for 6 months.
Wow.
And it was taught to medical and allied related fields, not necessarily all doctors, but there were some chiropractors and there were some therapists there to really teach you how to do acupuncture. And so I took the course and right away just really fell in love with the concepts and the ideas because they complemented what I was doing so much. And so that was 12 years ago. And I've implemented it ever since into my practice. And it's just a part of my treatment protocol and my algorithm. So I have a lot of information out of my practice. And you would be surprised how many patients ask me about that. It's become a real standard part of what I do now.
I love that. That is so great because, I'm all for alternative medicine, but married with Western medicine as well. The two of them working together side by side instead of one opposing the other. And you are a prime example of how that marriage happens, because you've integrated both parts of that, the Eastern and the Western medicines together in order to help your patients. So I kudos to you. That's wonderful.
It's interesting because I practice a form of acupuncture called medical acupuncture. So a lot of the medical professionals in the country practice that. So in other words, they're still using their diagnostic tools that they learned in medical school, but they're applying the treatment protocols for the meridians and needling for acupuncture that correspond to the illnesses that they're diagnosing. And that's what I do. And I primarily focus on musculoskeletal problems because that's what I treat. So that's what I do. But I had to be convinced at first. So the whole idea behind the course...
Did you have to hurt your back or something before you could be convinced?
Well, I had to actually go to the course and make sure that it really was a legitimate modality because I had doubts the whole time. So anytime a patient came to me and asked about acupuncture, I would just roll my eyes back in my head, really, until I took the course and learned about it. And then I started doing it right away. And I understood that the acupuncture meridians anatomically followed a lot of the neural pathways that we have in the body.
Absolutely. Yes.
And then I practiced on my staff.
Oh, I was going to say you practiced on yourself. I was going to say, that would have been interesting.
And family members. But when you have physicians in your practice that have problems and they come to you and you help them with acupuncture and then they bring their family members to you. And now I've done acupuncture on many family members of physicians in the practice.
Wow.
And I'm helping them. I've now convinced my partners that acupuncture is a legitimate modality to use, and so they refer patients to me.
I love that. That is great. That is great. Well, that really is, one of my questions that I love to ask is what makes you different? And I think that you've answered that fully, that, just integrating the acupuncture along with traditional medicine. And you're right, it does. It follows the meridians. And that's what you're working with, to get the blood flow going through on those meridians to encourage the growth of the healthy cells. So that's fabulous. Good for you. Good for you. So you said that you have 3 different facilities and that there are 14 doctors that are in your office. Are they all orthopedic surgeons? Or do they have their own little specialties? Like, one might work only on ankles and another one might work on shins or...
Sure.
Help us.
So I can break that down for you.
Okay, great.
So we have what we call a spine, sort of like a spine center in the group. So I'm the physiatrist who does the non-operative care.
Okay.
And then we also have 2 anesthesiologists that are board certified in pain management that do more of an injection-based approach.
Oh, okay.
And also do some medication prescription. And I, too, prescribe medications. And we all prescribe physical therapy. So we also have a full PT and OT center in both of our offices.
Oh, that's really good to know.
We do the full gamut of care.
Okay, great.
But we also have a fluoroscopy suite in the practice where the 2 pain management doctors do fluoroscopic guided injections. So things like facet injections and epidural steroid injections. And for people that have really chronic conditions that have failed those types of things, they even do pain pumps.
Wow.
So we have a group of doctors that do that.
Okay.
And then we have an orthopedic sports medicine doctor. And we have another doctor that specializes in hip and knee injuries and surgeries and non-operative care. And we have 3 doctors that do foot and ankle care both operatively and non-operatively. We have 2 pediatric orthopedic specialists as well.
Wow, that's really amazing. So you've really kind of covered the gamut. You've not only gone, geriatrics for yourself, but also you've gone all the way down to the pediatrics piece of it as well.
It's true. And that is really interesting because there are not many pediatric orthopedic physicians in the entire county. So one of our physicians just retired. And so we have another pediatric orthopedic surgeon, and then we brought another one in. So we have 2. And they do a lot of work for the pediatric cases in Palm Beach County. But I forgot, I left out. Very, very important.
Okay.
We have 3 orthopedic upper extremity and hand surgeons in the group, too.
Wow.
You would be surprised how many people have orthopedic upper extremity, shoulder, elbow, and hand injuries that really need attention. And we have 3 of the best in the county.
Oh, that's fascinating.
Yes.
Fascinating. Well, tell our audience again, and listeners, please, if you have any questions, please give us a call, 888-565-1470. Give us a call, and we would love to answer your questions, whatever they may be, concerning your orthopedics, whether it is, foot, ankle, whether it's surgical, non-surgical, and also the acupuncture piece of it as well. So please also give them your information.
Sure. Orthopedic Center of Palm Beach County's main number is 561-967-6500. And our website is OCPBC.com. And just log on to the website and we'll give you all our office locations and our contact information, and also biographic sketches on each physician and information about what each one of us does.
Oh, that's great. That's great. You were talking about the acupuncture, and have you had acupuncture yourself to help with any kind of pains or whatever that you might have had? Have you experienced it?
I have experienced it.
Okay.
I'm a believer in it. I do some acupuncture on myself. It's hard to do.
I would say.
It's hard to do, but I have.
Okay.
And I'm a big believer. When we were doing our training for the program that I got certified in, we had to do acupuncture on each other.
Okay.
So we did that also.
Well, I remember that probably, 10 years ago or whatever, I ended up tearing off one of the bones in my foot. And I had gone in and they had to do surgery and they put a pin in it. My ligaments were so strong that it just tore off the back of the bone. So I went in, I had this surgery, I had a cast on for like 10 weeks, and I come out, and my girlfriend, she's bugging me. She says, okay, you got to go to this acupuncturist. You have to go. And I'm like, all right. So I'm on day 4 on crutches, and she gave me name, telephone number. I went in, 3 needles, 20 minutes, and the doctor said, walk to me. And I looked, and I said, I haven't been on this foot in 10 weeks. Are you kidding me? Walk to me. I've got to tell you, I walked on that foot for 45 minutes without any pain at all, without any crutches. I walked in hobbling with my crutches. I walked out with my crutches in my arm. And I've got to tell you, I was shocked. So I did the acupuncture, and then I went back the next week and I had another session done. So it went from 45 minutes the very first time, and then during the week, I was able to put more and more weight on it. I go back in for my second treatment, able to stand on it for, 3 to 4 hours, started physical therapy, and I'm telling everybody, oh, you have to do this acupuncture. It's absolutely amazing. I really have no pain. I've been able to walk on it. I mean, I still had the little cast boot on. So I go to my podiatrist at week 3, and I come walking in, and he looks at me and he says, where's your crutches? And I said, I haven't had crutches for, a week and a half. If you hurt that foot and we got to go back in and do surgery again. And I'm like, oh my goodness, wait until I take x-rays. So I go in and he takes the x-rays and he looks at them and he's looking at them and he's looking at them. Wear regular shoes. Was the last thing I've ever heard out of his mouth. So I have got to tell you, I am a huge believer, not only acupuncture for humans, but also for dogs. I had both of my dogs go in for acupuncture as well. So I'm a total believer. And I'm so thrilled that you have brought those two modalities together in order to really, relax on the pill taking because, the side effects of the pills, it can be really, really devastating. But also, though, to enhance, their life and know that they don't need to live with pain and that the acupuncture is a great way, a holistic way of being able to deal with that pain.
Yes, I agree with all that. I think that you can tell somebody that it's virtually non-invasive. Of course, it's invasive because you're inserting needles, but the needles only go under the skin just a little bit, and most people don't feel it at all.
Right.
And if they do feel it, it's a sensation that goes away.
It's like a mosquito bite.
Right. And if you can offer patients an alternative and not affect their organ systems with drugs and medications, and protect them and yourself with a lot of the things that are going on with drug abuse and drug diversion, it really becomes a better alternative. Yes. And you can combine it with therapy and stretching and all the other modalities that you want to do. And that's what I do.
I love that. That's fabulous. And what makes that really, really, even more important is that sometimes our senior population, they're on so many drugs already, and then you go and you add more drugs to it to try to relieve more pain. And a lot of times it's so difficult for them just to be on schedule with their pill taking. So, anytime you can get off pills, and especially even the side effects and everything from pills. Now, I do understand that there are circumstances and times where the medication is necessary, but I'm all for the alternative. And I want to commend you for that. That's excellent.
Thank you.
That's excellent. Well, it has been an absolute pleasure to have you here. Again, if you have any questions, please give us a call at 888-565-1470. We would love to hear from you. And even if Doctor isn't here right now, we can still take your calls and pass them on to you.
Sure.
So just in case, you haven't gotten to the phone or you're busy eating or something of that nature, you can still give us a call and we'll make sure that that he gets any of the questions that might be coming through from you. So thank you again. It is absolute pleasure to have you. Thank you for educating our audience and letting them know that there is an alternative, that it just doesn't have to be one way, that there are many different modalities that you end up being able to provide for them. So we're going to break for a commercial. Don't go away. Make sure you come on back. It's a short commercial. And stay tuned because we've got another great guest coming on. So we'll see you in a little bit.